mention anything more specific about the how, how you identify potential problems that you want to solve or address next. So just kind of from the organizational perspective, what can other healthcare networks or hospitals that are trying to innovate with an innovation hub, how they should go about this? Because there's so many things on the market that it's really difficult to really
absolutely.
kind of
Absolutely. And some of this obviously changes contextually. We're a particular kind of network. We're very representative in Canadian terms. We're home to a very diverse, probably the most diverse population in Canada, both in terms of age, in terms of socioeconomic status, in terms of ethnicity. And so representative of a certain market, but we do, I do recognize that in certain settings, people might have to sort of tailor make, their approach to respond to the needs of their population. In this instance, we thought about this long and hard, and while innovation initiatives to take hold inside an institution obviously have to have a strong support of the leadership, which is certainly the case in our network. And while the kind of the strategic vision is formed at that level, it is equally important to understand what the perception is at the grassroots level. So at the level of the patient, and then at the level of the frontline clinician. And so the way our governance is built, it's built in phases, right? The innovation trajectory is built in phases, and obviously the first phase is clearly identifying the needs and priorities. And so that we've accomplished that by building our governance on both the top-down and bottom-up approach. On the top, we have an executive committee that oversees the work of OROT, that is constituted of key individuals presided by our president and CEO, that kind of sets the strategic vision for the network. But then I have established a number of grassroots mechanisms that seek to understand what the need is as perceived by the users, whether they be clinicians or patients. So I have done so by establishing a network-wide community of practice that's been somewhat disrupted. Participate in many communities of practice, and often it can turn into theoretical exercises where you discuss concepts and notions. I really wanted this community of practice to be about practice. So it is about discussing needs and discussing experiences and how people go about to innovate. Then we have established a system of collecting needs, both push and pull. So we have a website that is connected to the network website and the individual institution's website, where people can come and fill out a form and submit their idea. Whether they are an employee or they are a potential industry partner, they can submit our idea. In turn, we have also established a mechanism where we can put out call for ideas and call for proposals, so proactively go and seek feedback. And then where projects emerge is a sort of an intersection between these two, between the strategic level and these sort of ideas that emerge from the field. From there on, we have a sort of a pre-gating and gating process. Pre-gating establishes the feasibility and whether something has a potential to form into a project and what sort of support it would get. And then the gating process formalizes that and assesses, officially approves that, establishes that the project, is deemed strategically important and well-resourced to go on. At the gating level, we also establish whether something constitutes as a research or as a quality assurance project, or we have this third category, which is co-development. And then based on that, there are paths to be followed. If something is researched, then we want to make sure that it's rigorously looked at by our ethics board, research ethics board. Same thing applies to something that's deemed a quality assurance, but it's just a different instance looks at it. And then we, in collaboration with these two instances, we have also established some standards in terms of what are co-creation, co-development activities, like what standards they should submit to. Once that process is completed and we look to establish something that is as optimized and as accelerated as possible, we then form teams around these projects that have every project has to have a clinical champion, clinical lead. They are, in case of research studies, also they serve as principal investigators. Every project has an executive sponsor. I currently fulfill that role, so I make sure that I look at all the projects transversally, and I make sure that all the resources that are needed both internally and externally are available, and any blockages removed. And then projects typically have project managers, and then we look to mobilize whatever clinical capacity and non-clinical capacity is needed to make sure that the project goes on. We set up a very clear timelines, and with the ultimate goal of integrating the innovation. So from that, in that regard, we have also a very close collaboration with a ministerial body called Innovation Office that looks to facilitate the collaboration between private sector and the ministry and take applicable innovations system-wide.